First things first, what is hepatitis A? Hepatitis A is a contagious liver infection caused by the hepatitis A virus. It mainly affects the liver and is generally short-term, but it can cause uncomfortable symptoms and even lead to hospitalization in more serious cases. Unlike some other forms of hepatitis, hepatitis A doesn't lead to chronic liver disease. Hepatitis A is typically spread through something called the fecal-oral route. This sounds technical, but what it really means is that the virus is present in the stool of an infected person, and it can spread when someone accidentally ingests food, water, or surfaces contaminated with tiny traces of this stool. Children are especially susceptible because, well, they're not always the best at washing their hands. In fact, hepatitis A outbreaks are often seen in places like schools, daycares, or households where there's a lot of close contact. So if one person gets sick, it can spread quickly to others, especially young kids who aren't always diligent about hygiene. Now let's talk about symptoms. Some children with hepatitis A may have no symptoms at all, which is common, especially in kids under 6. However, older children and adults can experience 1. Fatigue, 2. Nausea and vomiting, 3. Abdominal pain, especially on the right side, 4. Loss of appetite, 5. Fever, 6. Dark urine or pale stool, 7. Jaundice or yellowing of the skin and eyes. Symptoms usually appear about 2 to 6 weeks after exposure and can last a few weeks to even months in some cases. Alright, here's the most important part, how to prevent hepatitis A. There are 2 major ways. First and foremost, vaccination. The hepatitis A vaccine is safe, effective, and a key tool in preventing this infection. It's recommended for all children in the United States starting at age 1. The vaccine is given in 2 doses, 6 months apart, and provides long-lasting immunity. If your child hasn't received the hepatitis A vaccine yet, be sure to talk to your pediatrician about it. Vaccination is especially important if you live in or travel to areas with higher rates of hepatitis A, or if there's an outbreak in your community. The second key prevention strategy is good hand hygiene. This is something you can start practicing with your kids at home. Wash hands thoroughly with soap and water, especially after using the bathroom and before eating. Teach kids to wash their hands for at least 20 seconds. Try singing a song like Happy Birthday twice to help them get the timing right. Use hand sanitizer if soap and water aren't available, but remember that it's not as effective as thorough hand washing. Hand hygiene is one of the simplest yet most effective ways to prevent the spread of hepatitis A and many other infections. Practicing these habits at home and encouraging them in schools or daycare settings is so important. So to recap, hepatitis A is a contagious liver infection that can spread quickly, especially in group settings with children. Vaccination and hand hygiene are the best ways to protect your child. If your child has not been vaccinated yet, talk to your pediatrician about getting it scheduled. And as always, encourage regular hand washing. This goes a long way. Thank you for tuning in to learn more about hepatitis A in children. Stay informed, stay healthy.